acid reflux and GERD and what can be done about it that is clinically proven safe and effective. So, acid reflux and GERD. GERD stands for gastroesophageal reflux disease. This is a disorder in which the contents of the stomach actually re-enters the esophagus, which is the food pipe, and can actually regurgitate, and you get this feeling of firstly your food regurgitating, also heartburn. It can also be pain, discomfort, bloating, many other symptoms associated with it. And most patients are put on medications such as proton pump inhibitors, or if it's mild cases, then antacids. And people become dependent on those for years and years, and then they develop other conditions as a result of that. For example, if you're taking calcium carbonate, that can lead to constipation. Also, if you're taking proton pump inhibitors and you're reducing the amount of acid, that can affect your ability to absorb certain nutrients such as proteins, trace minerals, and fat soluble vitamins. So the medications are not always the most effective way long term. Sure, they'll get rid of your symptoms. I'm not saying they don't work; they certainly do. But it's not the best thing for your overall physiology and overall health. So let's first talk about what actually causes this condition. Firstly, on this list is a bacteria known as H. pylori. Now, the H stands for Helicobacter. Now, this is a bacterial infection that can affect the digestive system, specifically the stomach. It's also behind ulcers. It's the bacteria that causes ulcers, which is why when somebody gets ulcers, they often put on um, antibiotics. So, H. pylori is one of the potential causes. In addition to that, inflammation appears to play a very centralized role. Just a couple of years ago, a study came out about this, showing that inflammation is probably the number one cause of this problem. In addition to that, imbalances in stomach acid can cause heartburn and acid reflux as well. If there's too much acid, or even if there's too little acid or diluted acid, there's actually let me first talk about the next part and I'll get back to that. Improper function of the lower esophageal sphincter. This sphincter is right at the bottom of the esophagus, and it's basically the opening from the bottom of the food pipe into the stomach. It's the point at which the food enters the stomach. Now, there's a sphincter right there that has to close and shut off so that the food cannot come back up. If that sphincter is not working properly, it can remain open, and that's how the contents can come back into the esophagus. But there's mechanisms behind that. There's so many things that can cause that. There are smooth muscles involved. As a result, minerals and certain nutrients like vitamin D, if there's a vitamin D deficiency, that can become a problem. Being obese can also cause a problem. Also overeating can cause a problem with the sphincter. And There can be actual anatomical issues with it, but it's usually because of one of these factors. Now, if there's an issue with stomach acid, for example, if the acid is not strong enough, there are actual receptors on this sphincter that detects the acid and shuts off and closes off the esophageal sphincter and actually causes it to close. So if the acid is not proper, that sphincter will not close because there's a detection mechanism right there in the esophageal sphincter to detect the acid and say, okay, time to close. And then the content stays within the stomach and digests. So issues with stomach acid can also be one of the causes. Now, obesity, as I said, creates a lot of pressure in the diaphragm, especially if you have a lot of visceral fat. And that can actually put a lot of pressure into the diaphragm and more pressure into the stomach and the lower esophageal sphincter. Having a hiatal hernia can also cause this problem. I'm going to be doing an entire video on hiatal hernias, so I'm not going to get too much into that right now. So these are some of the potential causes. It can be any of these. It's very important to figure out what it is and get that taken care of. So let's talk about these and what can be done about them. So, a few remedies. Now, you'll notice that on this list, I did not put a remedy for obesity. And I'll talk about that in a moment. So, let's start with too little acid. If there's too little acid in the stomach, the easiest thing to take is amla. This is actually a fruit. This is a very acidic fruit. It contains citric acid, ascorbic acid, fullemlic acid, garlic acid, a whole bunch of different acids. And it helps to improve the gastric secretions. And it's really good for your digestive system. Now, in addition to this, other things like apple cider vinegar can help as well. Betaine hydrochloride can help as well. But the reason why I'm putting amla at the top of this list is because it was used in a clinical trial for a very specific type of acid reflux called non-erosive reflux disease. It's one of the types of GERDs. And yes, GERD is actually an umbrella term for, multiple subtypes. And so amla was quite effective in that specific type of acid reflux. Now, when it comes to too much acid, you can actually balance this out with DGL, which is a form of licorice root where the glycohizin within it, which is a compound that can have an adverse effect in the body, is actually removed. And I'm not going to get too much into licorice root and that specific compound, but DGL is basically a safer form of licorice root to use. And that can be used long term. And this can actually work as an antacid. In addition to that, baking soda is a powerful antacid. That's because baking soda is a very base substance in comparison to acid. Now, if you have a hiatal hernia, two things, like I said, I'm going to be talking about this in a separate video and I'm going to go really in depth with it. There are two things that can work. A specific type of acupressure can be done on that in the area of the epigastric region of the stomach that's basically just below the sternum. Acupressure in this area, there's specifics to that can actually give you relief. And then there's certain types of yoga practices that are really good for this, like the breathing exercises to strengthen the diaphragm, and certain yoga postures, like I think chair pose is a really good one. So again, hiatal hernia, make sure you subscribe to the channel and you'll get a lot more information on that. This video is really not going into enough depth on that topic. Now, LES, the lower esophageal sphincter. There are three things that can help for this. Acupuncture in clinical research. Now, I'm not an acupuncturist. I don't do this, but um, acupuncture is a type of alternative medicine, and I should be saying integrative medicine. That comes from Chinese medicine specifically. This type of acupuncture has been used in clinical research and found to be more effective for managing conditions of GERD that are associated with issues related to the esophageal sphincter, more effective than the pharmaceutical route. Very effective, highly beneficial for many purposes beyond just GERD and acid reflux. Many uses for acupuncture for pain and other things, spasticity and neurological conditions. And so that's one thing that can help you. Fat loss is another one. Now, I mentioned fat loss specifically, not weight loss. Why is that? Well, if you take a whole bunch of diuretics, you'll lose a bunch of fluid from your body and your weight on the scale will go down. But that doesn't mean you lost fat. That means you lost fluid. If you go on a crash diet, you can end up becoming what's called skinny fat, where you have all of this loose skin. That's because you lose muscle, not fat. Fat is the thing that is unhealthy. So it needs to be fat loss. So there are many things that can be done about fat loss. Follow my channel. I'll be doing videos on that too. Tons of things that can be done for it. At the top of the list right now, the easiest thing you can do, intermittent fasting with a nutritionally dense diet plan, meaning your diet should be full of foods that are rich in nutrients. In addition to that, if you have been consuming a lot of carbohydrates, cut the carbs down. You don't have to go into doing a ketogenic diet. If you want to, that can be beneficial for some people. Other people, going plant-based helps. Just cutting down your carbs, doing intermittent fasting, and exercise can help. But if you have an underlying problem causing you to gain weight, like PCOS or fatty liver disease, or hypothyroidism, then you need to get that addressed as well. But make sure you're losing fat, not just weight. There's a difference. If you chop a leg off, you lose weight, right? But it's not necessarily fat. Well, I'm sure there'll be fat in your leg too, but that's a ridiculous example. Vitamin D is very important for the lower esophageal sphincter because vitamin D metabolizes a lot of nutrients and plays a very important role in the functioning of the smooth muscle. It works together with magnesium for the smooth muscles. And remember, the sphincters are basically made up of muscles. All of the functional parts of the digestive system are all smooth muscles. So vitamin D is really important for that. Now, inflammation, as I said, can be at the root of most problems related to this. And in the case of inflammation, to be honest with you, almost everything I've mentioned will help with inflammation. But once you have the symptom of acidity under control, using curcumin can be very beneficial. Curcumin is the substance that is extracted from turmeric, which is the East Indian spice. Now, curcumin is the key chemical constituent that has the powerful anti-inflammatory benefits. There are many other anti-inflammatories out there as well. Boswellia is great. Black seed is great. I don't recommend black seed when you have acid reflux, though. Well, in not in most cases. Some cases it can actually be quite beneficial. Last on this list is H. pylori. Now, H. pylori, as I said, is the infection that can cause ulcers. It's a bacterial infection, and so the three things that have been found to inhibit H. pylori and actually kill the bacteria is DGL, as I mentioned up here, D like a dehydrated licorice root. Mastic gum is something else that can help you. You can get that at the health food store as well. And vitamin U. Now, you've probably never heard of vitamin U. You've probably heard of vitamin A, B, C, D, E, K, but chances are you haven't heard of vitamin U. That's vitamin U is actually a vitamin-like substance. The chemical name for it is methylmethionine. It's found in cabbages. And the way to get vitamin U is to actually consume cabbage juice, the same way you would consume celery juice. Now, you're probably thinking that sounds awful. It's going to taste awful. It actually tastes very much similar, in my opinion, to celery juice. I've tried it. It's not that bad. Very beneficial and works really quickly for treating H. pylori and actually healing up ulcers. Now, personally, I've never used that with any of my clients or my patients for treating acid reflux. I've always used mastic gum or DGL. But when it comes to ulcers, vitamin U is extremely beneficial. So these are some of the things that you can use depending on what the cause is of your acid reflux. It's very important to understand what is causing it, get a proper diagnosis. Go to a holistic health physician. So you can go to an MD who does integrative medicine and functional medicine, or you can go to a naturopathic doctor, or you can come to an Ayurvedic doctor like myself, or even a Chinese medicine doctor. In fact, I think your best bet for quick relief in the case of issues with the lower esophageal sphincter is to go and get acupuncture. But the rest can be handled with diet and lifestyle. So yeah, that's my take on acid reflux and a few things that can help you. I hope this information has been beneficial. And if you'd like to get in touch with me, you can do so through my website, drnishal.com. I do online video call consultations. So no matter where you are in the world, you can get in touch with me and I can help you. I'll see you in the next video.